Today we will discuss about pneumonia. What is pneumonia? Inflammation of the lung parenchyma is called pneumonia. Types of pneumonia. Number 1, Lobar pneumonia, and another one is bronchopneumonia. In case of Lobar pneumonia, one or multiple lobes of the lungs are involved. In case of bronchopneumonia, only bronchus of the lungs are involved. Now, what are the factors that predispose to pneumonia? Cigarette smoking, old age, upper respiratory tract infection, alcohol intake, human immunodeficiency virus, glucocorticoid therapy, and recent influenza infection. Organisms responsible to pneumonia, which include bacteria and virus. Bacteria: Staphylococcus aureus, Streptococcus pneumoniae, Micoplasma pneumoniae, Legionella pneumophila, Clamydia pneumoniae, Klebsiella pneumoniae, and another one is Haemophilus influenzae. Virus included influenza, parainfluenza, measles, rubella, herpes simplex virus, adenovirus, and cytomegalovirus. Now, clinical features, which include symptoms and signs. Symptoms include cough, initially dry but later mucopurulent sputum, hemoptysis, fever, rigor shivering and malaise, and pleuritic chest pain. Now, the signs of pneumonia. On general examination, patient is toxic, ill-looking, raised temperature, and increased respiratory rate. On respiratory system examination, on palpation, reduced chest expansion, increased vocal fremitus. On percussion, percussion note is dull. And on auscultation, bronchial breath sound and increased vocal resonance. Now, what are the investigations done in pneumonia? Complete blood count. If bacterial, neutrophilic leukocytosis; if viral, leukopenia. ESR and C-reactive protein are raised. In chest X-ray, radio-opaque shadow with air bronchogram. Sputum study, microscopic and culture. Pulse oximetry to see arterial oxygen saturation. Now, what are the treatment of pneumonia? In case of uncomplicated community-acquired pneumonia, amoxicillin 500 mg 3 times daily orally. If patient is allergic to penicillin, clarithromycin 500 mg twice daily orally. If Staphylococcus is cultured or suspected, flucloxacillin 1 to 2 gram 4 times daily intravenous plus clarithromycin 500 mg twice daily intravenous. In case of severe community-acquired pneumonia, clarithromycin 500 mg twice daily intravenous plus ceftriaxone 1 to 2 gram daily intravenous. And thanks for watching this video.